I'm Reece Harding. I'm training with NTGPE and that's through ACRRM, which is the Australian College of Rural and Remote Medicine. So I grew up in Jervis Bay, South Coast, New South Wales. Hadn't really ever thought of working up in the NT. My first medical exposure to the NT was as a medical student. I went to Darwin for 2 months. After that I trained in New South Wales for a little bit and then I moved back up to Nhulunbuy in 2015. Never even heard of the place, had to Google map it and look up pictures and whatnot. I came back a few times that year and then caught on to the NT bug and went to Alice Springs for 12 months to do emergency medicine. I've worked in Katherine and then part of my training last year was between Darwin and Palmerston Hospital. Some of the clinicians here are just some of the most phenomenal rural generalists I've ever met and impressive people, and I think I wanted to be a part of that, so that's what drew me into staying. And so this might be I think it's about my 6th time out to Nhulunbuy, but yeah, that's why I keep coming back because it's so great. I joined NTGPE at the start of last year and I did my advanced skills training in anaesthetics at Royal Darwin Hospital in the Big Smoke, and then I moved back out here to Nhulunbuy and I work between MeWatch at the Aboriginal Health Service doing general practice work in Indigenous health, and I also do work at the hospital doing emergency medicine and anaesthesia. Working out here, the patient clientele kind of varies in the presentations. There's a lot of chronic disease here, respiratory disease, renal disease, cardiovascular disease. My job might include starting work at the Aboriginal Health Service, treating, coughs, colds and wounds, and then it might range from anything doing a resuscitation in the evening in the emergency department or being on call for a cesarean in the middle of the night. It's quite variable, but that's what makes it so great. Working in remote general practice has developed a lot of different areas of my personal and professional life. Medically, you get better at making more independent decisions. You develop skill sets in, more in emergency medicine, kind of critical care areas where you don't have, intensivists or ICU units, and things like professional resilience, working, independently, sometimes alone, in very small and remote places, but I think that's what leads you into becoming a great generalist, which is what anyone working up here in the NT usually tries to do. It's a very geographically, culturally and medically impressive place, the Northern Territory, and anyone who's been there it's a no-brainer to have at least had some exposure to the healthcare system and how it operates, what the training's like, the types of things that you see and the types of people you meet. There's no question that you cannot get this anywhere else in Australia.